The Quebec government must recognize systemic racism in its institutions, according to the coroner overseeing the investigation into Joyce Echaquan's death. The 37-year-old Atikamekw mother of 7 died on September 28, 2020, live streaming as staff at a Joliette hospital 50 kilometers northeast of Montreal hurled racist insults at her as she lay dying. Quebec coroner Gehane Kamel released her report Friday with recommendations for various bodies after finding Joyce's death was accidental but avoidable. Joyce died of a pulmonary edema, but racism and prejudice she faced contributed to her death, wrote the coroner. Joyce's live stream lasting over 7 minutes, 2 hours before she died. She's heard screaming for help and calling for her husband. In the report, a transcription of the video describes Joyce saying, "It's hurting me. Carole, come see me. They're over-medicating me." Healthcare staff heard saying, "You're dumb, only good for sex, and we're paying for this." Joyce's daughter, by her side an hour before she died, filmed a second live stream for about 10 minutes, her mother's condition rapidly deteriorating, her breathing labored. A nursing resident seen trying to get a response from Joyce, saying it's because of the medication. In her less than 2 days at the hospital, the coroner writes Joyce was quickly judged as a drug addict and her calls for help denied because of prejudice. In pain and agitated, she was heavily medicated. She was physically and chemically restrained and isolated, something the hospital policy says should be used as a last resort and needs to be documented. But Joyce's case wasn't. The coroner heard from 44 witnesses over 3 weeks, writing that once Joyce's death was confirmed, civil witnesses overheard staff expressing their relief that she was no longer an inconvenience and was finally dead. Kamel confirming Joyce was ostracized and her death directly related to the care received, and indicates that if it hadn't been for Joyce's own video, the public would have never known. And of the 15 recommendations Coroner Kamel made, the first, that the Quebec government recognizes the existence of systemic racism within our institutions and make a commitment to contribute to its elimination. That the Lanaudière Integrated Health and Social Services Center, which oversees the hospital where she died, ensures the effective integration of the Manawan liaison officer into the establishment, ensures a collaboration mechanism between the Manawan dispensary and the emergency department of the Lanaudière Hospital Center, ensures that the notes in the medical file reflect the reality of a patient's care, quickly sets up training and activities for the inclusion of Indigenous culture. In Montreal, Alyssia Rubertucci, City News.